for joining this session with Dr. Naweed Syed. You probably know him. He's the professor and scientific director of the Alberta Children's Hospital Research Institute. He has so much accomplishment. I was reading his bio. I can talk, I think, for a few hours to talk about your accomplishments, Dr. Syed, and your contribution. But as we running behind the schedule without any further ado, I pass it on to you. Go ahead, and we're all ears.
So, good morning, everyone. Thank you, Shelley and Arshad Mahmood, for the invite. It's really pleasure and privilege. Let's make it not a monologue, rather a dialogue. So, if you have any questions, by all means, step in. What I'm going to do is that I have been tasked to make you guys uncomfortable in your surroundings. And that's what I will do. I'll shake up the things, but at the same time, I'll show you really a new world that most of these people in the academia stream, they don't show you. So I will actually not show you beautiful Malign Lake, Marble Canyon, and Mount Robinson, and Athabasca Glaciers, and Athabasca River, but I will actually take you in the valley of the life. So that's something that we can all enjoy. So once again, thank you for being here. I will do my best if I could share my screen. Let me see. It's a bit slower. Can you see my screen? Or?
Yeah, I think it's opening up again.
Okay. I think all you need to do is minimize your browser where the Google session is, and oh no, dropped out again.
Can you see my screen now? Or?
No, not now.
Okay, let me try again. Full window or entire screen?
See if you can share the entire screen, and or you can share a window, which will be the I guess PowerPoint. Is it PowerPoint that you're trying to share?
Yeah, it's a PowerPoint.
So yeah, you can probably share the window and then select a PowerPoint.
Okay. Does this work?
It's coming up right now, and yes, perfect, excellent.
So thank you everyone. Now that I can only see my own screen, I will be talking to myself, and that you guys can snooze off if you really want, because Shelley might be keeping an eye on you, but not me. So I think what today I'm going to do is really talk to you about innovative technologies and where the future of medicine really rests or relies. Somebody asked me in Bresky, how come you have that many assists? And he said, I don't pass puck to my partner where he is, but where he's supposed to be. So I think, when you guys, smart, intelligent people like yourself, budding, scholars, scientists, researchers, when you're thinking about career moving forward, you really need to think of not what is now, where the puck is now, but where the puck is going to be for you to really take advantage over others who are still looking for puck behind the net. So the question would be, where do we see the future opportunities for clinical research and the innovation that is related to clinical research? So it's not just really developing gadgets, technologies, or coming up with different things. It's always different approaches. The innovation is really such a loaded word which could be applied to just about anything which is creative, exciting, interesting, and most in need, and will help solve major problems in the world. So major problem solvers. Then you can also think about, similarly, clinical trials. People think that you can just take something and you take it through patients, and at the end comes a drug that could be really marketed. There is a lot more to clinical trials than just really thinking about having some paperwork and then you can fill the forms or tick some boxes. And I think whenever you have that opportunity, also you need to think about startups and then the business in the healthcare sectors, because that's another opportunity that either you can work for somebody or have people work for you. And the best means of sustenance is to create sustenance for other people. So creating new jobs, new opportunities in the healthcare sector, I think that's where the future of medicine will really lie. And I will give you a few shocker as well. So Calgary is beautiful and it's green now, and especially because of a couple of days of lovely rain. Otherwise, all the ponds were drying out. So what we're going to do today, the learning objective today, is to really think about various different technologies in the healthcare sectors where either the clinical trials or clinical research or clinical, with business acumen is ready to be come on the stage. So we will talk about health sensors and telehealth. And telehealth is becoming really, really important in this time and age. And we learned, great deal of lessons from COVID-19 related pandemic, where things were all, shut down. People were not meeting in person, and most of the healthcare delivery system went into telehealth mode. And living in Alberta, this is an advantage because here in this province, because it's one healthcare system, there are 3.7 million people under one grid. And it's an Alberta advantage if one could tap into the telehealth part of this, whereby it really becomes very important for clinical trials or anything that you are testing. This is an important area. Then the genetic testings and gene therapies are really also becoming very important. The gene testing, genetic testing, we can find out various, developmental disorders. We can do genetic testing for rare genetic disorders. We can also do genetic testing, for example, as to who could be vulnerable to a particular disease or who could be best protected or best benefited from a particular drug that is undergoing clinical trials. And then the gene therapies, one could invoke these approaches to be able to really not use pharmacokinetics or pharmacy or pharmacology to be able to drug these people out of their their ailments, but how to do manipulation at the genetic protein level or at the level of their metabolomics. So, and we will talk about immunotherapies and how immunotherapies are changing the field of medicine, because these immunotherapies could also be very effective and useful in terms of treating diseases or using our own immune system to fight off these diseases for which there is currently no cure. And that could be, cancer, it could be psoriasis, it could be, many other autoimmune diseases. And then you have 3D printing. 3D printing is also becoming really important in a sense that now you could 3D print bones and cartilages and hopefully some organs in the years to come as well. Surgeons are also doing 3D printing, so the brain scans, you take a brain scan, you 3D print it, now you actually have the replica of that particular body tissue or the organ that you are going to operate, and you could practice precision and also do algorithms to draw out your surgical intervention plan. Then we will talk about nanotechnology, how it is playing an important role, or it will play even an important role in the coming years when we launch our initiatives in the area of the future of the medicine. Then you have virtual, augmented, and mixed reality, and these are the skill sets that can enhance surgical skills, research skills of an individual, or even to deal with, post-traumatic stress disorder, ADHD, and many other developmental, brain ailments as well. Then there are surgical and medical robotics, and these are really coming online, becoming very important. And now you could perform surgeries using a robot that could go inside the magnet, and the robot is made out of titanium, and it could perform surgeries where the surgeon sits in a very different rooms. Or you could have hybrid operating rooms whereby you could have half machine operating and the other surgeon overseeing the function of this robot. And then you have artificial intelligence. It is becoming very important clinical tool for not only for research, but also for innovation. And equally important is now to reading, for example, when you see the radio, different kinds of a radiologist will normally look at tumors, pathology. They will look at many other aspects whereby oftentimes humans can make an error. The artificial intelligence algorithms can really predict and also precisely diagnose if there is an aneurysm in the brain, or if it is, there's a tumor, the nature of tumor and where it is. And they could do predictive algorithms to be able to predict as to where it is going to spread and where it is going to go. So I think artificial intelligence is becoming another game changer and a very powerful tool that you should really get familiar with. And then finally, brain computer interfacing or brain chip implant technologies, how they will change the face or the future healthcare and also medicine. So really getting to know all of these approaches and knowing where field is heading. And it's all about the timing. So the timing is really now. The timing also is very critical at this conjuncture. We know after pandemic, lockdown, the world will go through deglobalization. The world is going through deurbanization. And when you have these scattered networks where you don't have the opportunity to be at one place, there are many countries, the third world countries, and even the developed and the developing countries, they will be struggling to manage any future challenges that are thrown at them. So the world has really changed quite considerably. And this is where I think, many fields are heading. Let me introduce you to Naweed Syed. This is your new doctor. This is the doctor. This is the future of healthcare. And you will not be seeing now, you have seen for pandemic that how we had to really go through. And now it's half machine and half human. And these hybrid systems are the ones that are the future of medicine. And they are the one that will run the show in the hospitals and clinics. So that's scary. If you thought that's scary, let me show you something even scarier.
Only takes a moment for the unthinkable to become reality. In the near future, tragedy may come with new choices. Imagine you've been in a car crash that's killed your daughter.
Is she okay? Is she okay?
Or has it?
She's breathing. She's breathing.
Hey.
Is she okay?
Time of death, 9:17. Your daughter's brain was not impacted by the accident. If you wish to scan her brain for digitization and upload, you have approximately 5 minutes.
Do it.
Now imagine the power you wield when you can order a digital copy of your daughter's brain. And do you know what comes next?
Hi, Dad.
One day delivered to your doorstep is an artificially intelligent android that will act, look, emote, just like your daughter. Every memory from birth on will remain intact, but she'll also be a walking computer with access to all the world's knowledge. This is what your world will look like. This is the future of artificial intelligence. It's the deep future. Your body, gone. You're all computer, all the time.
So I hope that you're a little bit scared and maybe
Not scared,
Totally.
excited.
a little bit intimidated as well. But this is really, one of our saints, Imam Ali, once said that don't raise your children for your time, but raise them for their time. And their time is yet to come. So I think in many of these instances, it's really important that you start thinking about where the puck is going to be, not where it is today. So this is how far this is. We're about 30 years from now onward. I think this is what the reality is, and I will walk you through some of the work that we are doing, that we are already halfway there. So I think not investing or adopting these modern medical technologies and clinical research trial, aspects of will be devastating for both developed and developing countries as well. And investment in knowledge always pays the best interest, as Benjamin Franklin once said. So, there's, you may be saying, well, I have paid so much money, and, what do I get out of this particular program or this initiative or this, diploma that I'm working on, or, rotations that I'm going to do. I think investing your money, your time, your efforts into knowledge, it will always pay you the best interest in the longer run. After this program, I hope you will be best prepared to take on new challenges, and you will not be intimidated or scared by any of these approaches. You will be open to it. So the future of medicine really is an important area that people are not really thinking about. Most of these big powers, the big countries, are becoming more self-centered in a sense that they're worried about their own economy. The money will not be doled out to third world developing countries. They need to develop resiliency. They need to develop independence, and they need people like yourself. So precision health, what we call now personalized health, the health care system previously where you use the shotgun approach, just see some symptoms. And often I remember one time a patient brought in one child, and he told the doctor that, that I have brought one of my kids and I have 7 of them, all of them are suffering from same symptoms. So can you also give medicine for all of those? So, having a shotgun approach was the one that was used, and things have really changed. The more we get sophisticated, the more it becomes incumbent upon us to do personalized or precision health. It is not a shotgun approach. You need to deal with individual patient at an individual level and pay attention to the individual signs and symptoms. No 2 thumbprints are identical. No 2 irises are identical. No 2 patients are identical. And this is where most of the clinical trials death valley is. But, different people, and you've seen this with COVID-19 vaccine too. Some people develop, cardiac inflammation. Some people develop allergic reactions, and majority was still okay. So the precision health will really tackle individual patient at the individual level, and it is becoming a one-stop shop, what we call the knowledge mall. It is really a one-stop shop whereby you could, when you have that many patients and that many people, you have to have individualized and personalized data with exquisite precision as well. So the healthcare system is really becoming integrated, where you have every aspect of your healthcare, from pharmacy to really, detecting, to healthcare, the emergency department. All aspects are at the fingertip, and actually at the end of your fingertip. And this is where the healthcare system is really moving. So people who are not prepared for this tsunami yet to come, I think they will not be able to survive or benefit fully from healthcare systems. So if you are a doctor, if you are in the healthcare business, you really need to open your eyes and accept these and not just stay in a little cocoon. People are right now developing biosensor technologies whereby you could actually have this biostamp, and this biostamp could do so many things. For the elderly who are suffering from Alzheimer's disease, it could remind them when to take their medication. And if they take medication, it will also sense whether they have really taken. And God forbid, if they have fallen in the washroom, they could also send a beacon and an emergency signal to a loved one in the hospital. And it also, if they're having stroke or any other health-related problem, these biostamps can really pick up any kinds of signs and symptoms and alarms for cardiac arrhythmia or any kind of health-related issues. And they could pick these up and then communicate to the healthcare system for the elderly. Also, if your blood pressure has gone up, if your other issues have really gone up, these biosensor technologies are important because they could then tap into your personalized or individual healthcare aspect and then use as a diagnostic. And in the future, it could perhaps also become a therapeutic as well.
And Dr. Syed, sorry to interrupt you. So in your opinion, because you're like right in the middle of it, how do you think that people are actually accepting this change or like this future? Like Rafi found it exciting. I found it definitely intimidating, like, your privacy and all. So do you think that we as humans are absorbing it well, like the change that's coming?
Great question, Donnie. I think, the train has already left, right? So you really have no choices. And, whenever anything new technology comes in, people will throw their, hands up in the air. You've seen that even with vaccine in third world country, because of their ignorance and the lack of knowledge, and because not having the opportunity to be exposed to these technologies, anything that comes in new, we always find it intimidating. We always find it really scary. People will say, well, you put these vaccines have nanoparticles in them. And I will show you some evidence that has really pushed back not only third world countries, but also in the United States, 40% of the people who are really thinking that they are being tagged, and they find it intimidating. If the genetic testing has really made you maybe susceptible for future Alzheimer's disease, the insurance company is not going to insure you, right? So, not only privacy issue that you raised important points, but on the other hand, you also really raised an important issue that, does it really harm me other ways if my own personal information and my vulnerabilities and exposures are really, known to other service providers. So I think in the beginning, we are a little bit, people may be intimidated but the stronger we make our telehealth system secure, the better we will be eventually handling these. So these floods, gates are already there. The doors are already open. If we don't jump onto the train, we will be left behind like many other things. So I think in most cases, it's our ignorance at the end that deters our ability to really worry about those things. But I think we have to keep an eye on that as well. And I will give you some examples as we move forward. So similarly, I think I'm also chief scientist for Creative Destruction Lab. And at that particular forum, there are only two of us who will vet all technologies in the development stages, where they have either a prototype developed or they are testing. So one of the technology that came through a couple of years ago were these capsules, and these capsules are not only designed, you swallow them, not only designed to collect your, gut all bacteria, to determine your metabolisms or your microbiome of your GI tract, but they can also look for polyps, and they will take the scan shots and they will send it to the surgeon or doctor and telling them that, this is the polyp. If you wish, I could take it out, and they could really dissect it out using the laser power to be able to do this. And it doesn't need any endoscopy, colonoscopy. All of these approaches could be really, managed by using these simple capsules.
Dr. Syed,
yes.
I have a question for you here. At this point of time, how accurate these capsules are?
So, it depends what you really want to do. Whenever we develop, technology, as you guys are interested in clinical trials, they really have to go through clinical trials, right? And when you take them through clinical trials, you need to define as to what really the scope of the trial is. If you are interested in collecting, just the microbiota and microbial flora samples, you will just poop it out, and then you collect this capsule, and you could actually do an analysis on those bacteria and find out which particular bacterial flora is in your GI tract. That is easily doable, and that is now ready to really come in the market. It's been prototyped, it's been tested, and it's gone through the initial phases. These are harmless capsules. They are also made of cellulose, cellulose material, which just kind of dissolves in your body if it is left there for a longer time period. But to come to your point, excuse me, whether they could do surgical interventions, we're still not there yet. But it will take a few years whereby they could be programmed to, and also managed from outside. They are little drones that you could manage them, and they could perform surgeries and as well and take that little polyp out, or at the least take a snapshot and it shows you exactly what the size is, what is the nature of it is, and even collect sample to be able to tell you what it really entails. So I think, from a concept design to the idea being prototyped and idea being tested is already underway.
Okay. Because I was wondering if it's just about taking out the GI flora, and once the person poops out, then you take the capsule and study the GI flora. So you can study the GI flora anyways from the feces that we have. We do not need a capsule.
Well,
right?
we don't always really excrete, the bacteria that are not part of our food chain, right? So
Right.
And there are actually more gut microbiome, and the idea is that these microbiota in your gut, they define your personality in a real sense. You think about the Ethiopian population is less than 3 to 4% in the United States, but the incidence in those people of autism spectrum is almost 40%. And you look at the African American populations when they came to the United States, food affluency, also the kind of food, the junk food that they were not used to eating. When they started consuming, it changed their gut microbiota. And with the change of gut microbiota, their metabolism changed. With metabolism, it actually changed their entire body systems. And you look at similarly in Middle East, and people now have diabetes, hypertension, obesity, which was never really heard of before the junk food culture was introduced. So I think our gut microbiome will also define major aspects of our health, and knowing what's in there, not just what is excreted, is also really important, in healthcare systems. And there are many of these bacteria that are not excreted, especially, from your stomach lining all the way up to your lower part of the gut. You don't excrete all of these bacteria. They are part of your epithelium, which lines up, your tissue. And oftentimes, what happens is that when you have perforated stomach or your guts, those bacteria that are sitting there, pathogens, they don't get excreted. Rather, they chew up or the lining of your, either stomach or your duodenum. So collecting those samples will also tell you as to what kind of particular antibiotics that you need to really get rid of that flora. And you heard the story of Barry Marshall, who won the Nobel Prize. For most people thought that, your ulcers were caused because of acidity. And he ended up actually showing that, no, it's a bacteria. The bacteria actually, perforates your lining. And nobody believed him. His paper was rejected 54 different places. In the end, he infected himself with that, bacterial population. And then and then he cured himself, with that as well. Eventually, he won the Nobel Prize. So the point is that many of these things are not really excreted in your feces.
Got it. Okay, thank you.
So the next really, sure.
Sorry, Dr. Syed. So I have a question. So when we are talking about the diseases, so will these sensor detect the future diseases which is about to come in the near future? Like, for example, if a person is diabetic and he is prone to diabetes, and these sensors, can they detect that a person can get future diabetes, or there is no such point that there should be a doctor involvement always?
I think it's a great question. So what you could really do is that you could follow their health patterns, right? And many of these algorithms can predict if somebody is consuming too much sugar, and if you have the data for them already, this information can be integrated to determine whether, obesity, diabetes, hypertensions, you are susceptible to them in the years to come. And it could really draw up, it can, that your Apple Watch can monitor your heart rate, it can monitor, many aspects. You can also monitor blood sugar now using glucose sensors. And if it sees those spikes, so those patterns that are predictive based on your genetic history that you are susceptible to these diseases, they could draw up a chart for you and saying, indeed, you are susceptible. And so you have to really modify your eating behaviors. You have to exercise. We always say that, the obesity doesn't run in the family. Actually, no one runs in the family, right? So the idea there is that you could redesign and program the systems in such a way that it could prevent you from going to that stage where a particular, issue could become a serious health hazard or a problem in the years to come. So absolutely, I think, getting any bit of information that can provide you or help inform the doctor based on your medical history, I think could be a good diagnostic tool for years to come.
Thank you.
Dr. Syed, I think this algorithm kind of thing in form of history and visits with our family physician is already a part of diagnostic criteria, right? In future, maybe it will become more sophisticated, maybe.
Well, what will happen is that the system, as I'm going to introduce you, will force the physician to not just see you as a $60 bill, but rather to spend more time. I mean, that if a doctor sees 40, 50 patients in a day, that doctor is not going to have time to do all of these analyses that we're talking about. They will simply want to look at you, see you, listen to you, and then they prescribe whatever it is rather than spending time. So I think that the healthcare system should force them that, you cannot see more than 20 patients properly, right? So, and what these physicians end up doing is that they will see you quickly and they get rid of you, and then they sit down and write, over the weekend, fill out a form that is G5, D5, S5, to make sure that what they charge is actually billed appropriately. So it will make them honest as well. I mean, I always give the example that the Jesus Christ never went to medical school. He could still heal and cure. It's not the MD degree, it's the compassion and passion. And with your profession, that is really important. So I think it will force the medical professionals also to be more honest, So immunotherapies, and also I think, we know that body is extremely, when you think about North America, our health is really good. There is no pollution. There is clean air, clean water. We don't get exposed to, all kind of food germs. Back home, we could determine, you could drink gutter water and wouldn't have any effect on us. And here, if a slight perturbation in your food or recipe, it really shakes you up. So when our immune system is sitting here not doing much, it starts to attack itself, because of the boredom. And that is really a major issue. Alberta is the world capital of MS, for example. And also, because our immune system has nothing to do. You see the allergies, you see psoriasis, you see dermatitis. And these countries where there are almost germ-free kids, eight months of the year, you're indoor, kids don't go and, roll around in cow manure or in the farmland. So immune system gets so bored, starts to attack. So immune system is capable of doing this. Immune system is also, when it's not fully prepared and planned, like COVID-19 came, it took us really by surprise, because these COVID-19 viruses, they mutated in such a way that it created those 12 spikes. And those spikes could have been detected by our immune system, but they coated them with sugar molecules. And that fooled our immune system into not recognizing a threat. And by the time they did recognize, it was too late. And then the attack came, and the attack also was from our immune system when we caused, a major damage, which was caused by our own immune system. So I think it's really, can we harness this power of detection and attacking to attack, cancers and other things? And you've seen the COVID-19 vaccine. It's an mRNA-based vaccine. The same vaccine, same mRNA approach will now be used to tackle cancers and other diseases as well. So it's really immunotherapy. It will be another important future tool in the years to come. And we have nanoparticles and nanomedicine, whereby you could design these nanoparticles, or in such a way that they would have an antibody to recognize a particular tumor, and when it recognizes it, it will attach to it, and when it's attached to that tumor, it can selectively then release the toxins to destroy that, or perturb the multiplication system of those tumor cells and just neutralize it altogether. So I think these nanoparticles and the nanomedicine, they could also be designed in a way that they don't overload your lung or your liver or other organ systems, the kidneys, and whereby they could specifically be really targeted to the tissue that you have designed it specifically to tackle. So nanomedicine and nanoparticles are becoming also the future. And I think there are a lot of clinical trials and a lot of other interesting approaches will be employed there. And of course, then came the coronavirus, and it took us by surprise. These viruses have been around us for much longer than we have been on this planet. And the interesting thing about this particular virus is that it really harbors itself in a bat. And bats live in dark places. There's no UV light. These bats also live together in dirty places, in colonies, and they hang around together. And these viruses also have to adapt to the adapting environment of a bat. The interesting thing about bat is that when it flies, its body temperature can go up to 40, 41 degrees. So these viruses adapted themselves to survive. So in humans, when you get attacked by these pathogens, body temperature is raised to make it inhospitable environment for them to survive. But these viruses are so happy in there, says, bring it on. Fever doesn't do anything to me. And then that's how they cause really major, major damage. And so the mRNA-based vaccine was used again and very effectively, and the same approach will be used to now. You will see the next Nobel Prize perhaps coming, whereby a tumor will be destroyed using these kinds of approaches. And of course, people thought that if you are giving somebody, vaccines, you could have this radio frequency identifier as to who is vaccinated, who is not vaccinated, and you could also use these capsules, which could be implanted inside in your fingers. And not only that, it could provide you with the deliverance mechanism for, vaccine, but it also can tell you whether you are vaccinated or not. And you could really don't have to show your vaccination card or other details, and people next to each other will know whether they are talking to someone who's been vaccinated. And I think Tanya raised an important aspect about the privacy of these, whether you could get tracked. And if you can get tracked, if you are not vaccinated, your employee can either fire you, or they have the opportunity to do whatever they really like to do. And some people thought that maybe these vaccines capsules are being used to target certain or knock out certain genes in our brain which are related to religion, faith, and whatever. All these conspiracy theories is absolutely rubbish, because first of all, somebody will have to implant these. There are close to 4,000 people in Scandinavian countries who have these little capsules. They keep their passport, their ID information, their banking information, their credit card information onto these little capsules. And what you need to be able to do, just like you have a tap system, these could be really very close to only a few inches away from the actual radio frequency identifier to be able to read off the information, but only that information that you could allow them to be able to do this. So these are really interesting approaches that are also coming online. Then you have genomics, whereby you can take blood samples from a pregnant mother and you are able to predict whether the baby which is yet to be born may have any genetic perturbation or abnormalities, Down syndrome, autism spectrum, or what have you. And I think even for rare genetic disorders, that this genomics approach where you have, you could do human genome sequencing in less than $2,000 now, using these larger machines, which are really the workhorses, and it's becoming feasible. The first human genome cost us close to $2 billion, and now you can get this done in under less than $2,000. But what do you do with that information, with that data? You could do many exciting, predictions from there. And we learn, many of the communities, Hutterite communities here, even in Alberta, they don't develop Parkinson's disease, but they have high incidence of congenital heart problems for their young newborn. So, you could do an interesting genetic profiling to look at rare genetic disorders in many communities, and also people who may be susceptible to epilepsy and other kinds of things. But what do you then do with this information? Now, the CRISPR technology, which is gene editing, is coming online, and it can make targeted modifications to DNA accurately. So if you see an abnormal piece of the DNA that has shown up, or there are some modification in that particular DNA that is going to give rise to manifestation of a rare genetic disease or disorders in the years to come, you can selectively delete that part or insert the same sequence that should be there in its place. So gene insertion and gene deletion techniques will also really change the game in the field of medicine in the years to come. And I think this is also coming online and very important. And we also know that digital and telehealth, all of these techniques and technologies, of course, they are data heavy. They need a huge database to be able to manage them. How do you do this? Bandwidth is not really quite there with G3 and G4. And with the arrival of G5, you can now integrate all of these technologies, virtual reality to, semi-autonomous cars, to your doors in the house and lighting in the house, to a coffee machine, to even delivery through these drones of different parts. Even the drones are now landing at sites where even helicopter cannot land at a crash site. And then also attend the patient with really important life-saving interventions until the help arrives through other means. So the digital and telehealth is really the game changer. Now we're getting the quantum and cloud computing, which is providing the hardware, and that could be linked with your software to be able to really do magic. And then the magic could be that you have remote diagnostic and surgical suites, whereby a surgeon sitting in a very different city or country or hospital can perform surgery at a remote site, whereby you could actually do this both because of the bandwidth and the hardware that you have and the expertise that you have to perform diagnosis of these diseases, whereby there are no major healthcare centers, and then and deal with those patients remotely at a distance. So hybrid operating rooms, whereby you have half of these machines that are assisting a surgeon, instead of having a team of 10 different surgeons or experts, healthcare nurses, practitioner in the room. You could take advantage of these hybrid rooms, whereby half the task and job is done by machine and the predictive algorithms and your telehealth network to be able to really perform surgeries. Then you have intraoperative MRIs. Normally, I don't know if you're familiar with Canadarm. That Canadarm in the space station is developed by Canada. And that is based on technology that was developed here by Garnet Sutherland. His lab is right next to me here at the Hotchkiss Brain Institute. He developed the first Neuro-Arm, and that Neuro-Arm was a robot that was made out of a titanium. So everything in that robot is titanium. Normally, when you take an MRI image, the surgeon will decide how to perform tumor surgery in that patient. But often, when you open up the brain, the situation is very different inside, and it becomes quite difficult. 9-10 hour surgery by same surgeon, you get fatigued, you get tired, you make mistakes. You could actually rupture cerebral artery. The patient can die on the operating room. So the idea was that, can we take the patient inside the magnet, project the live image on a different room on a full screen, whereby surgeon can see a 3D rendition of the brain that he or she is operating. And at the same time, what you do in that situation is, because you cannot take any metal inside the magnet, you're taking the live images off the brain. You use a titanium robot, and that robot could be sent inside or coupled inside the magnet, and it can operate, and the operation is really with exquisite accuracy, that it can even stitch up things with remarkable, and it's all connected to joystick, and then joystick is controlled to haptics by the surgeon, and surgeon is using a joystick. So all those kids who played these games when they were young, could be the future surgeons of the 22nd century. The other thing, I'm coming to the last few slides, then I'll move on to some of my stuff if I still have time. So 3D printing is really becoming important, not only to 3D print precision mediated bones and cartilages, hips and knees and joints, but also to be able to now develop certain organs that could function really remarkably well. The other advantage of 3D printing is that you could print, scanned brain of a patient that needs a tumor surgery, and then from there onwards, you could design your own operating paradigm, fully automated, using robotic technology to be able to operate on the brain of that patient and take care of the tumor with exquisite accuracy. So the 3D printing, as I said, is becoming a really tool for tissue engineering as well. You can design different tissues and different parts of even bone, scalp, and shoulders, those kinds of things, for which for now we have been using mostly steel or other metal appliances. As I said earlier, artificial intelligence and machine learning, this is really where the future is. This is where the future of medicine is. And these artificial intelligence and machine learning tools will be not only predictive, but also will be absolute game changers. We're also thinking about virtual reality. Virtual reality is also a very powerful tool, not only to train surgeons how to perform surgery, teach students what the anatomy of different parts looks like. And these programs can allow you to enter inside the heart or brain and navigate your way through to be able to see every single part exquisitely. So, practicing surgeries and practicing other skill sets, and as well as people who have had other neurological issues, post-traumatic stress disorder, you could recapitulate the scenario with much better and healthy outcome. And of course, then you don't have to put these people on drugs or subdue them to the level of incapacitation. And virtual and augmented reality, is an important. We use this in our lab as well, which is really combined with mixed reality, whereby you could really have a lot of fun with these approaches. Now, as you also seen that because of the pandemic, we needed to protect our healthcare providers. Now these robots are making an entry into the hospital, whereby they could not only deliver you, important things, water, food, and other aspects, but also to change your bed sheets and do other kinds of things and take your vitals and the stuff. And these robots are also coming into the hospital. And finally, a couple of things, that the advanced robotics is really becoming an important aspect, whereby these technologies that we call them disruptive technologies, they're really based on artificial intelligence and machine learning. They are here to stay, not only to stay, but they will also be transformative, as I pointed out in my that video that I showed from National Geographic, and that, what really will be the future. So in my lab, we thought that brain is just too complex. It has just too many billions of neurons, more neurons than you see in the galaxy. How do you really tap into the information processing capability of the brain to understand how it functions, whereby there is no technology whereby you could record from large networks of neurons? So if you want to understand brain function, it is really imperative, it's pivotal, it's important that we acquire the ability to be able to monitor or record large networks of brain cells concurrently, simultaneously in a freely moving human or animal. The other aspect is if a brain cell is damaged, either due to stroke, trauma, injury, Parkinson's, Alzheimer's, because natural replacement of damaged brain tissue doesn't take place, how do you regain that lost brain function? And that's really one of the grand challenges, because here, the stem cell therapy also doesn't work because they turn into tumors. So we thought, how can we really gain access to brain's information processing capabilities? And if it is damaged either due to stroke, trauma, injury, Parkinson's, Alzheimer's, how can we go back and repair that part of the brain or replace the damaged tissue using a very innovative approach, for example, of coupling it or making bionic hybrids or neurohybrids. So brain-computer, interfacing, we thought that instead of really digging into the brain, can we tap onto the brain? And what can we learn? If we have sophisticated devices that can tap non-invasively onto the brain, and we can pick up, that you have probably more electricity in your brain, that you can light up quite a few bulbs in your respective room. So these, electric potentials or electric ability, brain is a kind of a power generator. If you could pick up the activity, and this is where, most of these neuro techniques come in place, is that we look at the activity of certain areas of the brain and fMRI and other approaches to be able to see which area of the brain is active. So the first we wanted to do was, can brain be interfaced with a computer? And it's not really a rocket science, because we are natural cyborgs. Andy Clark pointed out, brain plasticity allows us to attach ourselves to machines and computers, quite naturally. For now, you are attached to your cell phone, you're attached to, for example, your computer is attached to servers to the satellite, and then everybody is naturally connected. So we connect with these devices, electronic tools naturally. So we are natural cyborgs. And then our brain reconfigured itself in response to an input from a simplest tool that we use routinely. So, your facial recognition, voice recognition, all of these kinds of things. And you don't even think when you're typing on your cell phone or you are connecting images, the brain automatically configures how to integrate itself and connect with an electronic device. So it's far more open system than we ever imagined, and it even survives in the changing environment. We got so used to and kind of talking to our machines or screens, as I am talking right now, and it is becoming a natural habit. My brain is imagining that you're all sitting there, and then you're having this wave, and your faces are all lit up because of the presentation, or maybe you've fallen asleep.
Yeah, no, we're all awake, I'm sure. Naweed, I have a question. So all these questions that you just told us, my question is how do you narrow down your questions? Because one question leads to another question. And then because you don't get any concrete answers, so how do you narrow it down?
So, first things first. So first of all, really, you need to tackle the low-hanging fruits. You remember that you can only go from good to great in the area that you're good at. But that is not good enough, because you are good at so many other things. And these choices eventually cause paralysis. It becomes hard. We don't, intuitively, humans are procrastinators, and we also don't manage our time well. And we also think that once we have started something, that we have already finished it, rather than finishing it and then moving on. So I think making and developing this habit as to what it is that I am most passionate about, and what it is that going to change the world and make a meaningful impact in the lives of other people. If somebody could walk because of technology, or if somebody could, put a smile on someone's face, or, one a person can breathe easily because of you, is to define that true purpose of life. So the purpose of life is actually life lived with a purpose. And when you have a purpose, you will then narrow down everything else, not to really schedule your priorities, but prioritize your schedules as to what you really want to do. So these distractions, of course, knowledge is a base. The universe is expanding. As the universe is expanding with 16,000 kilometers per second, so is our ignorance is expanding as well. So you need to really dial down and focus on certain things that you could deliver them first, or bring them to fruition or completion before you take on the others. You might have seen, in our third world countries, when these oxes or bulls are rotating around a well to pull water out of the land, out of the ground, they put those goggles on their eyes. And the poor bull thinks that it's been walking all night and it's traveled around the world a couple of times. And because you don't want it to see what else is going on. And so it doesn't feel depressed or doesn't get dejected. The same thing is that with humans, if you take on a challenge, put the goggles and block those distractions, because they are disruptive. They are disruptive. They will not allow you to consolidate your memory. They will not allow you, they are interfering devices, the background noise. So if I am talking and, you turn on your, own microphone and the kids are playing the background, neither will I be able to communicate properly, nor will you be able to get that information. And same thing happens in the classroom if distractions are occurring outside. So the important thing is to focus. And to focus, you really need to shut down this background noise by putting those blockers in there. And then focus at the task and let it evolve naturally. Because if you are thinking on your own, you are invoking conjecture, but you are using your own guesswork. And that may not be really what the animal or what that particular experiment or protocol is telling you. You let your organism, your experiment tell you what is going on rather than you telling. And if you allow it to communicate to you, whatever you're doing, it will provide you the information and it will provide you the next steps, rather than we on ourselves using our conjecture, trying to force our ideas onto that particular experiment or the model or that organism. So it's really always important to let the preparation talk to you, tell you that particular experiment that you're working, let that experiment decide for you as to what you needs to do, or what needs to be done, and what you need to follow as a next step. So what we do is we often jump the gun, we use conjecture, we use the guesswork, and guess what? It takes us into a tunnel digging exercise whereby it becomes a snake pit that we can't find our way out either. Does it make sense?
Very well said. Thank you so much.
Yeah, thank you.
Yeah.
Okay, so our, as I said, brain changes all the time. So it's really important that that we think about this one. So I'm going to show you this, power of your brain, and whereby this individual that you will see here, this young man cannot see his left hand. His left hand is completely concealed from him. He cannot see it. And in front of him, you put a rubber hand, and this rubber hand is what he is focusing on. And what the experiment is to stroke his actual finger, at the same time stroke this rubber hand, and he has the feeling of his real hand stroking, and within seconds, his brain will adopt this rubber hand as his own hand. Watch this and how it really develops.
Practice.
Oops, sorry.
Practice. Here you can see the fake hand, focusing on it. There's the real hand, not focusing on it, simultaneous stroking. And there are various ways you can test it.
So let me show you one more time.
Practice. Here you can see the fake hand, focusing on it. There's the real hand, not focusing on it, simultaneous stroking. And there are various ways you can test it.
So this is really your adopted brain. And the way you adopt it, it will allow you to not only go into the future, but also simulate with what is going on in the recent, recent times. So brain-machine interfacing is when you really adopt an action or your imagination. Brain scans has shown that when, for example, I reach out to grab this glass, if you are imaging my brain or recording from my brain, those areas of the brain that light up when I reach out, the same area of the brain will light up when I imagine that I'm reaching out to that glass and I'm picking up that glass. So the visualization, this is why, can improve performance. We know that, visualization, and the famous, German general said that you conquer a particular, bridge 10 times in your head before you put your soldiers on the ground. And any engineer can tell you how to build a bridge. The great one always asks the question, why should a bridge be built in the first place? So that why, and then visualizing in your head, driving car or doing all of those kinds of things, they will improve your performance. So your brain automatically, really, the action and imagination are recoupled together. So thought translation machine that taps into the motor program in an animal or a human, imagining that particular act, it decodes the distinctive electric command to the device that puts the thought into an action. So, this is what we do. The conscious part of our brain scans 42 frames per second. The unconscious part actually scans 1.2 million frames. So if you let your unconscious part of your brain run the show, it will take over all the time. So up until now, for example, you didn't know where your foot was. Only when I reminded you, where's your foot? And you started to wiggle. So, oh, it's here. I didn't realize. That's the unconscious part of your brain. And it is scanning 1.2 million frames to give you both spatial and the time resolution that you are in, whereas the conscious part of the brain is pushing you to focus on what is being said here. So, so when you put your thoughts, you could actually also enhance your performance in that one. So what we do in our lab is that we could plant these surface electrodes onto the brain, and whatever Tom is doing here with that particular monkey or the robot will mimic his actions, blinking eyes, moving facial, and there is nothing really attached to it.
Can you please turn the red
You
light
can
on?
turn the lights on,
Turn the green light on,
green
please?
light on, or turn it on and off. You could even bring in young kids. You put these electrodes around their scalp, and whatever they do, they could really control these robotic monkeys through their own brain computer interfacing. We train them to control these cubes in the tunnel, go up, go down, go left, go right, push it back into the tunnel, move forward, move backward, and have them, once they have learned to control it in this cube, they could also operate the computer. And I'm going to show you why we use this particular thing. So here, Tom is only imagining to drive car. There's no remote control, it's brain-driven car. So he's only thinking about, and he's positioning the car exactly with exquisite accuracy. We can also take a drone, same way, that little cube was in the tunnel, and we can get it to fly around in the lab. It's all brain controlled. We put little sensors onto these drones. They provide constant feedback, the geoposition, as to where it is in space and time, and that individual's brain will then adjust its movement accordingly, and you can see those sensors also flashing. And even in a very tight space, you can bring it to make a landing. So what you can do is that using these approach and technologies, you can interface mind with these semi-autonomous devices that you can either fly or take off. And these are non-invasive. There is nothing you need to really implant. Their brain, the person who's operating gets pretty fried. It takes a lot of focus and a lot of attention. So most of the blood supply and the glucose goes into that areas, and the other areas of the brain feel kind of a little bit fatigued. So we have to give them a sugar cookie or candy. And then the idea was that can we now get into the brain and try to really interface the semiconductor technology and chips planted in the brain. And what you see currently in the clinical situation is you have these stimulators that are planted for patients who have Parkinson's. And these patients, did not respond to medication. The only option for them left now was to do surgical intervention. So deep brain stimulation and electrode, DBS, is planted in the brain. The patient can stimulate those areas that brain cells are dying, and they will stimulate the remaining brain cells. They release their goodies, the dopamine, and as a result, the symptoms are alleviated. But it's a one-way talk. The stimulator is stimulating brain cells, and they're shouting, stop, 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 and nobody listens to them. The other approach is that we use for epilepsy, where you can mount the surface electrodes, and the patient seizes these electrodes, pick up the activity, but there is not much that they can really do about this other than just detecting it. We wanted to do was to make a bionic hybrid whereby we could stimulate a brain cell non-invasively using a semiconductor technology. And when this brain cell talks to its counterpart, it will stimulate this cell and the transistor underneath picks up a signal. So you complete a loop whereby an electronic device can talk to brain cells and brain cells can talk back to it. So imagine a scenario that stroke had killed this part of the brain, and these two cells from sensory to motor, lost their contact. You can bypass it using this electronic technology where transistor picks up the signal and then the stimulator will stimulate that neuron, reversing what you saw here up there. This, I think, is still dynamic. Neuronal dynamics is still science fiction, few years, whereby you have a complete integration of these devices, whereby Elon Musk is really working on. So how do you really do this? Of course, you can't do these experiments in human brains, and you cannot put these chips in. You got to learn first, take baby step, and then gradually develop these technologies and bring them into the market for clinical trials. So long-term brain recordings, of course, we developed these, these little incubators. These incubators have CO2, PCO2, temperature, humidity control, everything is controlled. And we can keep brain cells alive and even slices alive for days to weeks to months. And we can really study their properties, their ability, their connectivity, their network properties with a remarkable degree of accuracy. We also had to develop these substrates which brain cells did not find as, toxic or and somehow didn't like them. So we had to coat these dishes with biomaterial that is conducive to brain growth or is friendlier with brain cells, so they cannot really, get this kind of toxic interaction with those or mismatch. So they grow beautifully. They're really happy campers. We can grow large networks of these brain cells and monitor their activities for days to weeks at a level of individual neurons and individual brain cells, and which is pretty cool. But what do you do? Those are still cultured cells. How do you go to the next step? And we use brain slices for that. So these are naturally built in circuits that Mother Nature had built. And we can now record their seizure activity or the pattern activity in the intact slice at the level of individual neurons and individual cells. That's really pretty cool. But still, you would say that you are only making contact with those brain cells that are contacting your electrodes. You are not recording cells that are sitting in different layers. So imagine that brain cells or the slice is sitting onto the electrodes, they protrude into the slice, and they're monitoring the activities of certain parts of only certain groups of neurons. So we wanted to really take it to the next. The idea is that, in collaboration with Mike Koliko's lab, we've been working on these technologies that allow us to grow these cells on silicon wafer. And these silicon wafers, when cells are grown on them, we can label them with fluorescent dye, either voltage sensitive dye or calcium indicator dye. And whenever that brain cell fires, it will light up like a Christmas. So a laser is fired through the microscope. It changes the properties of the wafer. And then when wafer's properties change, it will activate only those neurons that are underneath that laser coming through. And, voila, guess what happens? You can now monitor the activities of large networks of brain cells concurrently, up millions of cells as they are firing away. So now you have the ability to be able to monitor not only hundreds and thousands of cells that are making contact with the chip, but also larger networks of brain cells that are sitting there and firing away. And so what the future really holds is that, as might have seen these monkeys that have robotic arms, and if the sensory motor cortex of this monkey were to make a contact with the palate, the sensory motor cortex, or the visual cortex, will talk to sensory motor cortex that this is what I need to do. Just imagining the action. And when those parts of the brain fire, if you were to plant a chip in that sensory motor cortex, because you designed that chip, you also designed this robotic arm, you can pair them together in a way that when sensory motor cortex fires, it talks to the brain cells talk to the chip, and then chip can talk back to the brain cells, and it allows them to really make that adjustment. So this is where these technologies are heading in the future. But we wanted to take it for clinical testing for the seizure detection, because this is where you could plant these chips for a short term and then see what the outcome is. So the idea was that to take a team of neurosurgeons, biomedical engineers, and put it together, and we wanted to really test it in humans. Normally what happens is that you have these surface electrodes. They are mounted onto the brain to detect seizures, for example. And there is the 30-foot cable. The children will have to stay in the hospital for 10 days. They are attached to a 30-foot cable. The sensitivity of these electrodes is not really that great. They're also not MR compatible. So what we wanted to do was to develop a chip that is far more sensitive than conventional electrodes, which we have actually 300 times more sensitive. We also wanted to make sure that these electrodes are wireless, and that they are also MR compatible. So when you plant these chips inside the brain, the idea is to have the chip planted in the brain, and it has a little, reader that will pick up the seizure activity. And then the child or the person will have a little backpack that they could really detect seizures. And because they are MR compatible, we also have the chip image in a conformity with the entire brain region where the chip is implanted. And the idea really is that we could then not only detect seizures, but the software can create a 3D image whereby the surgeon will know precisely where seizures are coming from and can design a surgical intervention with exquisite accuracy. And we have been able to actually detect beautiful, beautiful signals, which is, much, much higher than any other commercially available electrode, even at the level of a single electrode. So I think the idea is now to take this approach into clinical trial and then be able to, not only use these electrodes as a detection tool, but also as an intervention tool, whereby we can go in and not only detect seizures, but also block their spread using the same semiconductor technology. I think I'm out of time already, so I will stop here and be happy to take any questions that you might have. I think I put everybody to sleep.
Yeah, this
No,
is
you did not.
really, a really good technique, Dr. Syed. I'm wondering if this technique can repair those cells that are not working anymore, or this is just for prevention purposes or detection purposes?
So great question. I think for now it is the detection, but you could imagine that a cochlear implant that could be planted very close. And as this person is about to seize, the implant not only picks up a signal, it dials your cell phone and tells you, Naweed, you're about to have seizure. Sit down. I just turned on the GPS locator. I sent 911 call to ambulance. The ambulance driver has all the information, your exact position. I also sent a message to your wife and told her that you're richer than you think. Just kidding. But the idea really there is to be able to not only detect the future, the same device, which is cantilever-like electrode, could, when it senses that the seizure or abnormal pattern is about to emanate from that brain, or is it triggered, because it's like an electrical storm. You don't know where the lightning is going to strike. So the moment you see that pattern of activity, immediately that electrode switches from a detection unit to intervention unit, whereby it can now discharge, the capacitor could discharge negative current or hyperpolarizing current or subduing current that spread across the entire region of the brain, and it pushes back that tsunami that is about to come to the rest of the brain. And it pushes it back. You can do the intervention that way. And I think in the future, if you were to make it a bionic hybrid, and that's our team is the first in the world to have a two-way communication between a brain cell and a semiconductor device. And that was absolutely breaking and a most essential part that made the world realize that actually a two-way talk between brain and a semiconductor device is possible. It can be done. And I think since then, this field has opened up. Previously, people thought that it was completely impossible. And our first paper that was also in the Discovery Channel and Time Magazine, and the highlighted stories were there. And the idea was that not only we could have a two-way talk between machine and a brain cell, they were chitting-chatting, but we also captured memory. We generated memory between the brain cells, and we could recapitulate that memory using the chip technology. So you can imagine in the future, could you really transfer memories from one person to another? That's another area that we're working with Neuralink and many other big guns that have the money to be able to really take it to the next level.
Wow.
Now, getting back to the predicting of oncoming seizures. So I understand where a few neurons will fire erroneously, and then it cascades, right? So what is the latency of the period where it starts to detect it, and then it actually happens, the grand mal seizure or whatever type of seizure?
So great question, Leonard. I think in some cases, we do have this sequential eruption of little volcanic activity. There are just like a few lightnings, they don't strike all the way, but those triggers are there where negative and positive charges come together. You begin to see that something is really about to happen, right? So in those cases, you probably have much more time, anywhere between 5 to 10 seconds, whereas in most cases about 3 seconds. Nurses can predict whether a patient is about to have seizure. Even your dog can predict it, and that is based on your facial recognition, the blood flow changes, and many other parameters. So you do get a latency anywhere between 3 seconds to 8 to 10 seconds and 15 seconds.
Okay.
So the longer the latency, the more erupted it is going to be, the more intervention coming earlier. You're driving, all of a sudden, you get 3 seconds warning or even 4 seconds warning. You can actually prepare yourself, pull out, right? Stop. And you have the ability to stop, even if you don't completely stop, you would have really, pulled it over and not have a head-on collision and other
Right.
collisions.
Now, have you done any clinical trials for intervention, during that latency time? Like you said, applying that negative voltage potential, or like changing, let's say, the neurotransmitter chemistry using lorazepam or anything like that? Have you been successful in that?
So, what we're doing is we're working on multi-pronged approach whereby these electrodes, we are also coupling them with a perfusion system, which is a 3D perfusion system. So then it is an automated process that when it detects seizures, could be deliver medication at that particular site, only at that particular site and in a very rapid manner, and targeting only the pathology that individual precision health module dictates. Because these children who are really thrown with calcium channels, sodium channel, potassium channel blockers, they're really nasty. They dumb down the brain to the level where a person doesn't really have any ability to do anything, kind of useful. And they have very, very bad side effects too. So the idea will be, I think, that in the long run to be able to really tackle it on site, but we have not started the clinical trials on this yet because we are building a complete module, because opening up a brain is not a joke, and and also to get surgeon to do a surgical intervention is not that easy. So we would like to have a complete unit, just like the space station, put together at one place and then really go through the clinical trials. But we are on our way.
Oh, okay. Now, I'm really interested, Nate, because you mentioned it yourself with the, the preventative drugs, like carbamazepine, for example, is commonly used to prevent onset of seizures, but it's also used as a mood stabilizer too, right? So, it changes your mood. Might become, that person might become obsessive compulsive, as a result of, taking that medication as well. So that's interesting. Another question I have, a really weird one. I noticed that one slide where you had the substrate beneath the neuron, and it looked like sort of like a checkerboard, as to say. Now, you're able to, like, measure, like, each of the dendrites and the synaptic bridges, right? And it's measuring the electrical voltage potential.
Correct. So I think you're giving me more reason to steal you from Shelly and those guys. And absolutely. So we can now monitor sub-threshold excitatory postsynaptic potentials from a single dendrite or a single axon with exquisite accuracy. So the idea is that not only pay attention to the cell body of the neuron, but what else goes on in the extrasomal compartment, the axon, the dendrite, because this is where the sugar chatter is taking place. The President of the United States or, Prime Minister of Canada, they are sitting in their respective places, but the organization is run by a whole bunch of people that surround them. And nobody really knows what goes on in those areas. So the idea will be for a comprehensive and a cohesive understanding, it's important that we tap into that information processing mechanisms as well.
Right. And then you mentioned earlier about the conscious mind and the subconscious. And you showed that one video with the guy who thought his hand was being stabbed. I actually saw this one study, for example, with a amputee, where you have that phenomena called phantom limb syndrome, and so you feel pain. So what they've done is they had the guy put both his arms, one partially remaining, but it was like a mirror box. So what he did with his right hand would look like what he's doing with his left hand as well, because it's a mirror image. And so they had him like squeeze his hands together, both at the same time, and he was imagining himself because he's seeing like the reflection of what would be his left hand that's been amputated, and now all of a sudden the pain is gone. That phantom pain is gone as a result of it, because he thinks for that moment that limb actually exists in that time. And then there was another one where you mentioned about virtual reality and augmented reality. I actually do have gear here that I bought myself, and so one of these days I should try and make a video where I can demonstrate how it could be used, where one surgeon can be instructing another surgeon from miles and miles away, you know, how to perform a certain procedure. Let's say like a coronary bypass or whatever. Another one is the robotics. I did pose the question as to, like, now the surgeon, can they actually program the robot preemptively, you know, before the procedure using, let's say, MC code or block code or something like that, based on images, manipulate the, let's say, the patient's head in a cage, and be able, you know, the robot would be able to operate based on that MC code that's been entered, and based on past images taken, like MRIs or.
Yeah, no, I think those are all great ideas, and you know, if I were really doing neurosurgery, I will not try to eliminate the phantom limb or the phantom pain, because that is really important for me to tap into a prosthetic arm and a prosthetic limb, rather than eliminating that aspect of brain, because, you know, the brain still thinks that the organ is there. You don't want to eliminate that pain, you don't want to eliminate that feeling, because you will not be able to then regain that part of the brain which has now been occupied by other cells taking over that motor area, or the sensory motor area. So the idea is that the phantom limb or phantom pain are really prerequisite for any brain-controlled prosthetic devices, because you want to keep that sense of feeling and sensation there. And once the person starts to utilize that area of the brain, the pain and the feelings will go away. And you should not really try to eliminate that phantom limb on a concept.
And I totally agree with you on that. I think this video that I saw was kind of prior to the advent of you know, how prosthetics are going now, you know, with connectionist AI, that kind of thing, right, as well. So, you know, and probably this patient chose not to have a prosthesis as well, maybe. You know, I don't know. You know, it was just a little snippet kind of thing that I've seen from like a documentary from before, but I totally agree. While the circuits are there, might as well keep them active, and don't, you know, attempt to try and reprogram the brain as to say, to accept that, oh, okay, this limb is gone, and you know, and then, like you said, you might not be able to make those future connections later on, or it be very difficult to retrain.
Yeah, all fair comments. I think Rafi had his hand up, so.
Yes, sir. I wanted to ask you that you said that, and I agree with you, that these anti-epileptics, they make you numb. And then with this technology, if we, for now, we are able to diagnose that if someone is about to have a seizure. And in future, it is possible that, or it is, I don't know if it is, you guys are working on it, that we will be able to find out that if someone is about to have a seizure, and then we can hyperpolarize or say send a negative signal and prevent the seizure from happening. So similar thing, a similar approach can be applied for the psychotics. Like those patients who have some psychological condition like schizophrenia or something, actually their neurons are firing abruptly and at a very, very high rate, and they're releasing more dopamine. So would it be possible in future, or this is maybe your subject of interest, that we can control their abrupt dopamine release and firing, using the same kind of nano chips in their brains, so that instead of being on those antipsychotics, which have their adverse effects, long-term adverse effects, and they make them numb, instead they could function better and be a part of a community.
So really great question. But the transcranial magnetic stimulation approach is already being used for children who have ADHD or hyperactivity, or they have obsessive compulsive behavior. So, you put these big magnets and you focus the beam on a certain area, the pathway that is the heavy traffic at that time, and you can disrupt that communication between those areas of the brain. And when you perturb those, you can stop their obsessive compulsive behavior, ADHD, and other kind of aspects. But one of the concerns that I have always had with this approach is because whenever a brain is like a motor home, you got to put things where they belong. You can't put them anywhere else. But if you did, you will give up that space. So we don't know if you perturb these normal patterns of communication from one part of the brain, what may happen to other areas of the brain. So the collateral damage, the collateral perturbation, the collateral alterations in other parts of the brain may be more harmful to them than the advantages that you might have. So, it has to be really very carefully implemented because, brain is so dynamic and so plastic. People, for example, who misbehaved in jails, they were put in these black boxes whereby they have really no light, only 8 foot, white ceiling, and they are there. And after a while, their brain becomes very imaginary. Even though there's no light coming, but they feel that they are out in the open. Wind is blowing, the sky is beautiful, blue skies, the birds are chirping, the butterflies are fluttering their wings, and they begin to actually see all of those kinds of things. So the brain creates that imagery because it wants to get out of that mess that that you're trying to contain. So Charles Bonnet disease, when you get older, you lose vision, your brain will actually become imaginary. You'll see cartoons, you'll see little chihuahuas, characters running around and doing all kinds of different things. You see people going up and down the stairs with nice oriental dresses and all the kinds of things. Brain begin to see that. Or if you had a stroke on your left side, people actually imagine that the right hand is still there, and you ask them to move and they say, oh, I just did. There is no hand. The hand movement is not there. So I think brain begin to concoct imaginary things. So you don't know if you're using these technologies that what alteration it does to your brain. That brain, when its normal routine is perturbed, it starts to create abnormal patterns.
Okay. So another question that since we are studying about neurons and you guys are studying about neurons and you can now precisely find out the electrical potential of the axons and dendrites. So what about, have you guys worked on it? At present time, what happens is that someone gets into an accident, they get their spinal cord served, and now they are paralyzed below their waist. So, I mean, studying neurons can somehow these technology, this nanotechnology and chips connect the upper part of the spinal cord to the lower part of the spinal cord, bypassing the damaged area so that they can have their functionality back.
See, you already become a scientist. I think that's what we are working on the next. And I need another talk. I took it out of it was part of my talk, but I took it out, whereby you can actually bypass. My original exposure to neuroscience was in the center pattern generators that you could take. You've seen the Second World War movie where a British soldier is attacking German, he's running, firing his machine gun, a grenade falls, he's decapitated. He continues to run and fire. The Germans left their bunkers, they ran away. They thought British soldiers could fight without their heads intact. They called them demons of the battlefield. And you've seen chicken when they also get slaughtered, they run around in the barn, for quite some time. The spinal cord has the circuitry that can generate motor pattern activity in the absence of any command coming from your brain. So we know that you need 300 neurons on ipsilateral side of your spinal cord to control your locomotion. So if you could not even connect brain, but you put a little, a chip that could trigger or activate those neurons, the way it would have been on and off switch that your brain would have done. When you're walking, you're not thinking all the time, right? You only, adjust your brain. Eyes will tell you there is a pavement, climb up, steps, go down. But the rest is all done autonomously. When you're running or walking, you don't take every single step seriously, right? It just goes on. So if you have a decerebrated cat, you make it run on a treadmill, it will continue to run for as long as the peripheral feedback is making it to do this, right?
So you wouldn't, sorry to interrupt, but wouldn't we need a circuit to give the exact command, like when to put one paw at a time?
Yeah, so you really have a joystick and a remote control, just like you're driving your wheelchair, right? So you are going left, right, turning, and then chip is that command. So when you have 300 neurons on each side, you have extension, flexion, extension, flexion, extension, flexion. You can program it, but then you also do it a safety mechanism whereby you don't have extension and flexion at the same time. So when you are giving this command, you can increase the discharge through the chip, or you can slow down the discharge, or you could also alter the command for lifting the foot up or down, right? So person can visually see, and then they're using the remote control, they're driving their own, just like you drive car, right? You're not attached to car, but you are commanding the car.
So another question for about neuroscientific point of view is that, in current times, when someone has a stroke and certain specific part of their brain has been damaged, and now it dies off, it's beyond repair. So they end up losing their functionality of their arm or something, arm or leg or some part. So instead, like you said that there's a chip. So could there be a chip that could be included with their brain that would just specifically control that function that the person has lost and synchronize it with the brain?
Yeah, that's what I showed you earlier, that the damaged part could be bypassed using the electronic. Right. You should be able to really do this to replace damaged part of the brain. But these are only simple motor functions that you could do, because not cognition, we don't know learning, memory, we don't really have the deeper areas of the brain, conscious, subconscious, which actually looks at the fourth dimension, and you see beyond everything else. We're not quite there yet, but the other things are possible.
The first video that you showed us, where the doctor died and they replicated the brain, and then they had the advanced version of their daughter, I would be scared. My parents would love to lose me, because then they would have not only the memories, but they would have an advanced version of me who would be excellent in searching a lot of things in the future. So probably they will replace me with that. They would not like to have me. They would like to have that robotic version of in the future.
I think maybe that's what will make them better people. Or I think artificial intelligence, or the future when we reach the point of singularity, is really an interesting topic. And maybe sometimes in the future we could really talk about whether, when you reach the point of singularity, when these machines are at par, they will find you useless humans sitting on their bums doing nothing, and they will eliminate us. And what will happen to war between them? There will be some with conscious and some with non-conscious. I think Bible and Torah and also Quran says that Ya ayyuhal insan, or human beings, if you don't behave properly, you shall be replaced. So replacement will be what we design and develop ourselves, and that will be these super AI. I think machine learning and robotics is a different topic. It's a really interesting what will happen when we reach the point of singularity. Will there be need for humans to even exist?
Well,
and what
maybe they'll have pity on us and take us as their pets.
Well, not really past, because the thing is that when they find us completely useless, they will consider us cursed on this planet. So if you give a robot an idea that, look, we're running out of land, we did everything to grow crops, we can't feed the world, the population is growing humongously, it will do a logical thing without conscious. It says, well, growing population is really the problem. To solve this problem of food shortage supplies, we are going to kill half of them. Boom. Right? That's it. Game over.
I think conspiracy theorists would think that COVID-19 was something like that.
Oh, I think, it's not the first time and it won't be the last time. I think, it's our indulgences into the world, into the areas that we are not supposed to go. We're not supposed to eat bats and snakes. We're supposed to stay away from the nature. We are, kind of interfering with the lifestyle we are not supposed to do. It's a lesson that we should learn from. It's early 90s pandemic, it wiped out 50 million people. It's not the first, it's not the last. And these viruses will continue to mutate to keep us honest, to keep us humble. We thought that we could do just about anything, and then a virus that doesn't even have a genetic code, brought us to our knees. And here you go, sunshine.
Right.
Yeah.
One last question. I want to try to understand that you mentioned that in the past that a lady would come with their one child and to a doctor and said that this one is having cough, sore throat, XYZ sign and symptoms, and my other kids who are at home are having similar sign of symptoms. So can you prescribe for them all? And you refer to that as a shotgun approach, which I understand. And now you're saying that using the genetics and the genetic coding, we are able to have a precise approach for the treatment. Now, I like this approach, but my argument and what I'm trying to understand is that, so if we have a very good, precise sniper, which can take out a single thing out at a time, but that does not mean that a shotgun is obsolete, right? I mean, precision medicine would be there. It will help us take some decisions where they are needed, but there would still be a need for shotgun approach in the field of medicine in future, or not?
Well, as an argument, you don't need a sniper, gun or a shotgun, right? Jesus had neither one of those. He had passion and compassion. So, when you have those important types of things, you will make a decision as to what will be the best practice in this particular case. But then not just close that file on that patient, but to learn and deduce from there as to what could be the other alternative and possibilities. No two humans are identical. No two irises are identical. Genetically too, 99.8%, we are hematologically, genetically all identical. It's not even in the genes. It's not in the proteomics. It's the environmental factor. It's your story in your life that has imprinted, tagged your synapses certain ways that gives you the feelings, the emotions, the behavior that you would have. So I think, a holistic approach, the future of medicine really is in precision health, where individuals have to be treated as such. Which part of the world you're from. We saw that the pandemic did not hit third world countries as hard as it hit the first order countries. It's because their immune system, their microbiomes, their exposure to germ was very different, right? And so I think, I have another meeting shortly. We would have really gone into the biology of the world, all organisms as to, how to deal with pandemics. So I learned it from bees. When you think about bees, when a virus infects a bee, that infected bee, when it comes into hive, it doesn't touch any other bees. They don't do tentacle greetings, hey, how you doing? What's up? And they don't hug, they don't kiss, they don't shake hands. This bee will deliver cargo and leave, right? And thus the virus becomes very crafty. It disorientates that bee. Instead of going in its own hive, it goes into a different hive. And then there are the guards that are outside. It's described as yasub. Those guards will check out whether the bee is bringing the good nectar, honey, or poison. And if she does, they kill her. All right, they just rip her apart. So they will check. But in this particular case, the guards move away from her. They don't touch, they don't search, they don't do body search. None of the other bees will touch it either. She goes straight in and she infects the entire hive. So, these viruses, you think that they don't have brain. They are very brainy creatures. They have evolved the system and they exploit the system accordingly. So, social distancing, we should have learned from these animals. We don't learn. Often people, when I give examples of the bee, and then you have spiders, you have, mosquitoes. People say, well, why you cite these, animals? We are humans, we are superior. I often tell people that, to measure gold, you often use these, copper-made balances, and the stones are often rock, and you are measuring gold with it. This does not devalue, the value of the gold itself. It's the examples that you use to measure it. So I think from that perspective, we learn a lot from nature. And unfortunately, we have forgotten that. I mean, I always remind people that, keep your eyes open. Learn from your environment. Learn how Mother Nature has adapted. And those are really the best practices.
Thank you, Dr.
Thank
Syed.
you so much, Dr. Syed. There's so many things to learn from you, and
Yeah.
everybody wants to leave, but we understand you have a meeting. I think if nobody has a question, we need.
I think Sarah has more questions. So.
Sure.
So, Dr. Syed, as we know that there is already shortage of doctors, especially in Canada and in Alberta, of course. And what will be the impact if in the near future all the diagnostic or the surgeries is being done by the robotics? Will there be an impact of people becoming a doctor, or will there be impact in the hospitals when the all robotics are taking care of the patients rather than the human beings taking care of the patients?
Well, I think great question, Sarah. I think it really is a pertinent question. It's also an economical question too. And then people earlier, Tanya asked about the ethics aspect of it too, right? So, I mean, we are in Alberta. We are actually producing doctors in surplus, right? It's just that the doctors don't want to go to the rural areas. They don't want to serve in that. Everybody wants to become a specialist. And I think, any aid that you could use, the tools that we could use will help a practitioner function better, should all be welcome. But, can you replace humans for all of this? We are not there for another 30 years or so. So I think the technology is all good, the MRI, the CT scans, you have all of these robotics and surgeries. They are not replacement for human. And I think they should not be developed with that particular purpose in mind, that we will eliminate these. These are really, they will push humans to go to the next level. Now you have a class that is doing those mandatory jobs, filling in forms and doing things like this, like we do online processes, but that doesn't mean that the humans are to be replaced. But it pushes us to go into fourth and the fifth dimension of our intellect, whereby we need to really, now using these tools, enhance our cognitive functions and then move forward, not to really digress. You can see that previously all the taxi drivers in London had the highest IQ than anyone else. But since the advent of GPS system, right, their IQ is dropping significantly. So if we allow our biological intelligence to be compromised and taken over by technical intelligence or artificial intelligence, we will really have issues. And I'll tell you one example, that data, and you could write this on your board, and this could be maybe the take-home message, data is not information. Information is not knowledge. Knowledge is not wisdom. And wisdom actually is not conscious. Humans are the only species that have conscious, right? And up until then we give that conscious away, we will still be superior to them. But this will make doctors more efficient, more effective, more technological, more better able to handle, you know, things and that you really need to adopt. You know, it's the greatest, the most noble profession in the world is being a doctor, and you are actually not the healer. Healing comes from somewhere else. You are only the witness. When you witness something, you should bow down and you say, thank you. Thank you for making me a witness to this miracle. So, you know, humans and machines, they have their own place, but they cannot really replace the original creators.
Now, if I can just quickly comment about, you know, machines taking over. Now, I'll put a psychological component on it since, you know, I've got a bit of background in psychology. Now, humans by nature, we're social creatures. We want to be around with others. It's kind of like that movie, Castaway. You know, if he didn't have that Wilson ball to talk to, he would forget how to talk, for one. And so we lose a bit of our consciousness that way and a bit of our own skills. And I don't know if you guys ever seen Star Trek, for example, and especially the Next Generation, where they have not only the food replicators, so they can just go to a replicator, get a drink or food, but they also have that bar, the 10 forward bar. And my dad was even saying one time where he goes, well, why do they have a bar on the ship when they can just go to the replicator? I go, because we need that touch from other people. We need that that connection. We need to hear the voice from an actual human being. We need that physical touch sometimes that's caring or whatever. And that's why I don't think, you know, machines will ever take over in that sense. But as Dr. Syed said, you know, they will assist us, and they'll eliminate or help us eliminate some of the problematic stuff as far as making errors, let's say, as long as it's programmed correctly in that sense as well, right?
That's correct. I think we should do maybe another session just on that aspect, when these machines take over, you know, and then they will be, what will be our position and role in the society in that case, and what is really needed for these machines to get to that level where they acquire the limbic system, the primitive part of the brain, and when they actually acquire that part of the brain, they could also have feelings, emotions. So, you know, for everything else you need and I think one thing that you would still need, humans will be shadi.com, you know. The marriages. Okay, I have to run, I'm sorry.
Thank you, Dr. Dave. We really enjoyed it.
Dr. Syed.
Thank you very much for attending our meeting. It was very insightful, and we appreciate all you guys joining. And so anyway, hopefully we'll be able to have another gathering like this pretty soon.
Yeah, we would love to visit your scientific lab one day.
Oh, absolutely. You're really welcome.
I would love a field trip there. Oh yeah, it would be like me in a candy store, like a little kid in a candy store.
Sounds like a good plan.
All right, and also let you guys know I'm into robotics as well. So now, not like surgical robotics, but in the future, maybe we can create sort of like a little session where I can show you how some of these engineers program robots to perform specific tasks and be able to do certain recognition. as far as like problems, so collision avoidance, that kind of thing, and using sonar, for example, or the speed of light to determine the distance between objects, for example. I also have a virtual reality set that has augmented ability as well, so I might be able to demonstrate that to you guys as well. And I hope to get a 3D printer soon, and I'll be able to demonstrate creating sort of like, let's say, an artificial valve, for example, with the 3D printer, or create a check valve that would be medically used, for example. There was one case, for example, there was this one lady where her cranium was actually too thick, so they actually excised the top part of her cranium, so part of her parietal plate, the frontal plate, and even part of the occipital plate. Actually 3D printed a new skull cap, basically, and attached it to the remaining bone tissue that was left over. So it's just one example where 3D printers have been used. Another is to create prosthetics or models for a prosthetic to custom fit for a patient.
That's great.
Yeah.
Thank you for sharing this, Len. Thank you again, Dr. Syed. You're muted. Oh.
My pleasure. I'm sorry for running, but I think you guys are all exhausted. Some of them you are almost ready to pass out. So I will bid farewell. Thank you for listening to my jibber jabber, and hopefully I think next time we'll have another good session. So
maybe we can excite it right now.
All right, sounds good. My people are shouting at me.
Have a great day.
All right, thank you very much.
Thank you.
Bye now.
Thank you.